Hello, my name's Neil Fraser. I'm the Managing Director of Meditexts.com and I'm a diabetic. In the UK, there are in excess of 5 million people who suffer from chronic medical conditions such as diabetes, Alzheimer's, epilepsy, lupus, chronic heart conditions, etc. People who suffer from these chronic conditions take regular medication and quite often have to live their lives in quite prescribed ways. This puts them at risk, particularly if they're involved in an accident or collapse in the street or are found unconscious, where they're unable to actually pass critical and relevant information about their condition onto the person that finds them. Meditext has been designed so that a person who suffers from these conditions and is found unconscious or confused in the street can have the information that's very relevant to their condition and important for their treatment passed on accurately and reliably. So how does Meditext work? The sufferer from the chronic condition would register on the Meditext website, and on that website they would put their condition, their primary condition, possibly their secondary condition, the name of their primary contact, who's the first person to call, the name of their GP and the telephone number, consultant telephone number, the treatments they're actually receiving for the condition they suffer from. They can also put down if they have any allergies or any other relevant information. If someone was a sole carer for somebody, and if they're unconscious and unable to help that person that they do care for, a secondary contact details can be given so that person can be contacted to make sure that the person is cared for. When the user has registered on the website, they will receive a confirmation PDF that lists all the details they've entered onto the website. The user can go back into the website and change those details at any time, depending upon whether their condition changes, whether their treatments change, whether their doctor changes, etc. They will also receive their personal Meditext number. Now this is particularly relevant because this number is on a card that is delivered on the PDF file. They can also buy a bracelet and have that personal Meditext number engraved on the bracelet. When someone finds them collapsed or unconscious and they find the bracelet, what they do then is text that personal Meditext number to 60060. Very quickly a text will be returned to the person that's done that with all the details that have been entered onto the website. These details can then either be given or shown to a paramedic or doctor when they turn up, health professionals, or it can be forwarded on to the 999 service. The benefit of this is that a paramedic or a doctor would actually have details about someone's condition and their treatments before they even reach them. Because this is an SMS-based service, it can be accessed 24 hours anywhere in the UK. This is a very important point as well. You could be up on a mountain and this system would still work. Under present economic conditions, charities are suffering from a lack of support and a lack of funding. Meditext will be donating via an affiliate system with these charities up to 30% of their income to the charity that the user comes from that supports the condition that they suffer from. If we take an example of Diabetes UK, if 10% of diabetics in the UK were to sign up for this system, Diabetes UK would receive around £700,000 every year from registering with us. For more information, please visit www.meditexts.com. I was introduced to Wellness Health Innovation by David Riley from Create T's and C's. I received a lot of information from the organisation, which is helping me to focus what I need them to help me with to move my business forward. Wellness Health Innovation will be able to introduce me to relevant persons within the police force, the fire brigade, National Health Service and the ambulance service. These connections are going to help me move my business forward.